very much, GMA Group. You've actually brought out very interesting points. So they are looking at integration of commodities and then central data management. So can we have presentation from LMCU? Could you just come forward, please?
Let's put our hands together for the LMCU group.
So for LMCU group.
Okay. So our group was tasked with developing solutions to these problems that were outlined. The fact that there isn't coordination between the supply chain systems. Every program has its own supply chain. So two solutions that we decided on was that the first one is that the state should drive the integration of these programs by setting up a forum to engage all the program and all the development, all the partners that are involved in implementing these programs. So that forum will bring them together so that they can align their work plans, they can align their transportation plans. Like if someone says that, okay, they're planning to ship on this day, the other program can leverage it. Okay, let's ship at the same time. Let's manage our costs. So they can work together. With their collaboration, they can control their costs better. They can generate better solutions, and they would have visibility on what each group is doing. Then the second solution is about implementing an information management system where everybody puts in their data on what their plans are as far as shipping of goods, as far as transportation, as far as all the other elements of the supply chain. So that would improve the visibility. At any point in time, anybody can log in. The state system can log in. The ministry can log in. The partners too can log in, and they can get a sense of what has been done, what the impact has been so far, so that there will be visibility on the data that is being generated from these programs. So those are the two solutions.
Thank you very much, LMCU. Let's give them a lot of let's clap for them. Sorry. Sorry. Then the third group is the commissioner group. Who is presenting?
Thank you very much. The commissioners group was given the assignment to come up with two actionable areas. And we look at the fact that by the position of a commissioner who is a policy maker, there is need to have a policy formulation that will give a sufficient backup to this program. And by that, we need to convince the state executive, the legislature, and all stakeholders to be able to develop a policy that will give sufficient law that will back the process of implementation, including infrastructural improvement for the purpose of sustainability of the program. The second aspect is that if the policy is on ground, it's not sufficient unless it comes into implementation. And we need to see that as a policy maker, whatever law or edict or policy put in place is carried to fruition. And so we supervise that. And we can only do that if we have the required human resource, and that is capital intensive. As a government, we need to get the required number recruited, build their capacity, and also to provide the enabling environment for financing. The financial environment has a lot of barriers that hamstring sustainable program implementation. But if there are policies that will lessen the barrier or remove some of these barriers, it will help the agency to function maximally. These are the two key areas we consider to be policy oriented, and as a commissioner we need to drive that through the necessary policy makers at the state. Thank you very much.
Thank you very much, Commissioner Group. All your points were really valid, and they are not far from actually what we did. Well, during the session, something happened. We had to move some people from one group to another. So how did you feel when we moved you from being from the DMA group to the commissioner group?
Well, initially I didn't like it, but I had to accept the conscription. So, but I enjoyed the last group very much. It's like you had a vision that it's the right place I should have been from the beginning.
So, did they welcome you? Did you fit in well? No confusion. All right then. Okay, Ma, how did you feel when we moved you from the commissioner group to the DMA group?
I didn't want to leave initially because I felt I was comfortable. We had started discussing. We had handed some points. But it was okay coming into this group. I found out what they were doing, and I fitted in, quite easily.
All right, thank you very much. We actually wanted to have this role play so that you understand. Like in Kaduna State, a lot of policy changes happen. You're a commissioner today, we just wake up overnight and we'll find out that our commissioner has been moved to another place or has been transferred. So like Madam here, when she was in commissioner group, I know there was a bit of resistance when she was leaving. And she just left, I have to go. There was no handing over, no proper handing over, so... and then we really had to struggle with him before he left the DMA group to the commissioner group. And eventually, he actually enjoyed his role. From being DMA, he went to being a commissioner in his group. That was really commendable. Well, we just wanted to portray what we actually went through this transformation project. Like, from the period when we started the transformation project, like, we had two commissioners. They actually changed, like, 2 commissioners and 2 permanent secretaries. And fortunately for us, the commissioner and the permanent secretaries that actually started this transformation were really like they were really driven to actually have this change happen. And when they were moved, we actually thought there was a bit of problems that's transiting from the former commissioner to the new commissioner. So we're just trying to say that usually when policies change, and when the key people handling some specific roles are moved, definitely some programs will suffer. And it takes some passion to really put in the next person into those shoes. That's making the person fit into the new roles. Well, what all of you did in the group, we really thank you. You've actually brought some good solutions to the problems of Kaduna. Some of them were actually what we implemented. Most of them actually, even though the words we use are just different, but the concepts were actually the same. So briefly, Mercy will come and take over. She will tell you what we actually did and tell you how we went through the transformation journey. Thank you.
Thank you very much for participating. I know it's not a kind of feel we expected in a conference, but we wanted to bring something a little different because we felt that telling our Kaduna State story has to be in a different way, not just flowing through what we saw, what we did, and so on. So thank you very much for participating. As she rightly said, I will put you through what we did in Kaduna State. In Kaduna State, our situation is not a case of partners coming to give us solutions to our problems, our healthcare problems. No. We stood up ourselves and decided we need a change. We need to solve the problems in Kaduna State. So we used 8 guiding principles in every step of our transformation journey. After the diagnosis of the Kaduna State health system, which showed in some of the slides previously, the leadership of the Ministry of Health now reviewed and identified supply chain as one priority area for intervention. So they asked for help in the verge to understand the fact of our essential medicine supply chain. We approached the Bill and Melinda Gates Foundation to help us. The Bill and Melinda Gates Foundation answered our call, our supply chain transformation call, And they came in not alone with technical and technical assistance from Pamela Steele's Associates, from E2 Open, Imperial Health Sciences, which currently takes care of our third-party logistics, and also CUNY Foundation. We then started the pilot. We started the pilot with pre-implementation phase. We realized that we need fact-based intervention in our transformational journey. So we listened to understand from key stakeholders in the states. We realized that technologies make things possible, but it's the people that make things happen. So we started with mapping the key stakeholders in the states. This picture, the first picture by your left, or obviously by your right, is a picture that shows a representation of our key stakeholders, where we start in a forum and listen to involve collaboration in our supply chain transformation. This picture cut across not just civil servants, but including our partners. I don't know if the picture is clear. You could see that NSKIP is well represented there. MNCH, I can see GSI, HSDF, and many other partners that are working together with us in Kaduna State. We also went ahead to deploy the RESI concept, which states clear roles on who is responsible, who is accountable, who is to be consulted, and who is informed in all our processes in the supply chain. We also had to find out our supply chain cost baseline and also validated these findings across board, locally and also globally. Next. Okay, after the pre-implementation stage, we went into the implementation stage. In the first stage of our implementation stage was the pilot design. As I mentioned earlier, we don't have any blueprints anywhere. We don't have a map or a solution we are following. Our pilot design is strategized on testing, learning, and repeating. So we test a design, we'll test a model. If it works, we learn from it. If it works, we repeat. If it doesn't work, we go back, we re-strategize, try another model, test, and on we go. In our implementation phase, we have 7 target areas in which we are developing. And success in those target areas will lead to expected benefits of real-time data visibility at facility level. In a situation where the DMA has clear visibility of what is happening of the inventory at the facilities, and the LMCU has clear visibility of both the facilities and also the DMA. We also will be able to achieve ease of tax burden on our facility staffs. Now you appreciate this looking at the map of the landmass of Kaduna State. Some facility staff will have to travel 3 to 4 hours just to procure commodities from the central area where the DMA is located. But with the transformation project, they do not have to come down. We have third-party logistics who does last mile distribution to the facilities, now giving us effective utilization of our limited human resources we have at the facilities. And also importantly, mastering our target areas will also lead to availability of quality essential medicines and health commodity security. Next. The stage 2 of our implementation stage is our preparation, pilot preparation. So we started our pilot preparation by leadership training. You know, it's not really true that leadership skills come with age. I don't think it is. So we started with training our leaders and instituting a committee, that's a steering committee, to take care of all policies and processes, to oversee all processes in the transformation project. We also did warehouse preparation during the pilot preparation. We did the junking and renovation of the warehouse in preparation for our pilot. And we had training of the pilot facilities and also mapping of our processes in the supply chain transformation. Next. Our key success in this journey is this. This is a picture of the pilot launch this year in January. This is the deputy governor. The governor, well represented by a deputy governor, he was in the pilot launch. This shows strong political will in our project. Around him is the Commissioner of Health. We have also the Commissioner, the Chairman, State Committee on Health. We have all the executive secretaries for the 3 agencies we have in the states. We have chairman, board of directors, and many other high dignitaries to show you the support, the political will we have, and the state ownership in the process of our transformation journey. Next. The stage 3 of our transformation journey of the implementation phase is all about testing solutions. As I mentioned earlier, we don't have a blueprint anywhere. So we tested data collection, bi-weekly data collection from the facilities. We also tested picking and packing at the DMA, and also tested last mile distribution using the 3PL. But we have challenges. Our challenges cut across poor handing over. We had a scenario during the role play. Poor handing over, when there are staff attrition, we have curfew that deterred in security challenge areas, that deterred facility work, and also we don't have SOPs at our facilities that will inform processes. We've learned in our transformational journey, we've learned that a change in leadership style from bureaucratic to transformational drives milestone achievement. We also learned in our bi-weekly data collection process that this process is cumbersome, it's time-consuming, it's expensive, and it's not sustainable. So we need a sustainable data collection system. We also learned that we need to review our payment system entirely. But currently, we are working on a number of things. We are working on reviewing our data collection system. We're working on having a real-time data collection system using SMS platform. We are also working on developing a key performance indicator. We are also working on a system to motivate our staff. We know that motivation is a key to success in our transformation journey. So we are working on developing a performance-based rewarding system, and we're also working on moving the 28 pilot facilities from the existing sustainable drug supply system to another system so that we'll be able to implement the policies. Actually, the policies in the SDSS system currently are deterring our implementation for the pilot. As I mentioned earlier, bureaucratic government deters functionality. So we need to isolate them and test them in different policies to see how it works before we scale up. Next. So as I earlier mentioned, that we use 8 guiding principles all the way of our transformational journey. They are: 1, state level ownership. You could see the ownership by the political will we saw during our pilot launch. We have also the systemic thinking. We use our brains. We have to think of solutions all the way along. We defined our success from the beginning with our target areas. We already know where we are going to. We use fact-based interventions. The health system diagnostic that was conducted, we also had our listening and learning and marking of our key stakeholders in the states. Intervention and collaboration. We're not doing it alone. We are collaborating with all our partners and political people in the states. We are also engaging capable technical assistance from the PSA, E2 Open, and so on. And we use lessons, as I earlier mentioned. We learn from whatever policy, for whatever strategy we are using. If it works, we go on. If it doesn't, we re-strategize. And lastly, commitment and sustainability. Thank you very much.
Let's clap for them again. Thank you, Kaduna State. Yeah, this is a very good example, right? And I want, as you go back to your state, I want you, in the next 1 year, you have to also have a transformational project. And when next year, when we are organizing this conference, we want you to come and showcase your state. I hope that is okay, right? Now, we're going to be closing the session for the day. It's been a very long day, right? Before we do so, I would like to call the national coordinator to give us few remarks before we close for the day. Remember, tomorrow, we are going to be here again. Please, we want to start 8 a.m. on the dot. Please, we want to start 8 a.m. tomorrow. Can you do us a favor by coming here earlier than 8 a.m. tomorrow so that we can start and finish? We have 3 sub-teams, and the minister is also coming tomorrow. So, NC.
Hello. Hello. First, how did you enjoy Kaduna presentations? Hello? Please, Prof, don't go. Yeah, you know, we say, honor to whom honor is what? If you look at Kaduna, Jigawa, Kano, and few other states, they are different. They have developed one kind of self-drive in the way they do their things. So what you see in Kaduna, you see it in some more states, and there is something we see in those states. Those were the states supported by Part 2 some 10 years ago. Do we recall? They were the states supported by the Part 2 program. And luckily, the Mongo Park that did that work is here. Yeah, there was a Mongo Park that did that work. Mr. Kuma Vimal. Can we recognize him? Yes. Yeah, so, we appreciate what we call tested models. The kind of food our grandparents were used to cooking, and we don't forget them. And so that is the kind of stuff. Those ones are assured. So we thank Part 2 for that support, and we recommend that those who are bringing some technology should also consult those who were able to sow such seeds that have survived. We talk about sustainability. So when we are still playing with sand, we are talking about those things. We used to wonder what it is, but now we are seeing them. So thank you, former Part 2. Part 2 has gone. Yeah, but the human beings are still here with us. Ladies and gentlemen, the Director, Department, Supply Chain on the Global Fund, Martin Ellis, that's the man standing there. I still remind you. So the money that we are using to run is coming from that guy there. So they are the ones giving us the thing that is we are using to move. And we are now having some other, the VC of University of Benin, has he left? Okay, so he was with us. So what I'm going to say now is not political because I'm not a politician. Are you listening to me? The Honorable Minister of Health, Professor Isaac F. Adewale, left Benin to come and open this workshop at 3. He flew in with the Vice Chancellor, University of Benin, and other dignitaries. So somehow or the other, the National Assembly summoned our Honorable Minister. So at 2 o'clock, so he moved to National Assembly. The VC touched down here. So that is to indicate to you that supply chain is in the heart. You know, heart, there are two, the better one and the half one. So the supply chain is in the other better half of our minister's heart. So that's why he flew in. Unfortunately, he was unable to come here directly. They are still in session at the National Assembly. The issue is not a secret issue. Is that Nigeria wants to revitalize her vaccine production. And we are doing that in collaboration with one of the pharmaceutical companies. So they have gone to National Assembly to go and defend it. So we have a government that is responsive. Anything that touches us, we move ahead. The embarrassment we had from CSMR break, that's what we're addressing now by revitalizing our vaccine production. So just to let you know that we are still waiting, but since we have to close now, so tomorrow we expect the minister to briefly come here and come and open and close the workshop. And also have some tete-a-tete with our dignitaries from America, Geneva, and other places. So we beg your pardon to be patient with us and to be rest assured that the ministry is solidly behind what we are doing and they are spiritually here. So thank you very much. I hope we are enjoying ourselves. So, is it any other thing? No. So thank you very much. So we see you tomorrow, 8 o'clock. Thank you. Yes.
No, is there